With me is Congresswoman Marcy Kaptur to talk about health care. And right now, it seems Americans are divided. The latest AP poll says it's about half and half on their opinion on that bill that passed the House. A lot of people are nervous about things. What can you tell us about the bill that passed the House?
Well, first of all, I tell people we're at first down. In other words, relax. Don't be anxious. If you have insurance you like, you can keep it. But if you think your prices are rising too fast, in the House bill there is an insurance exchange where you would get other choices if you want them. Over half the uninsured in our area are small businesses and their employees. This is really an excellent plan for them. For the first time they could get coverage. Imagine close to 40 to 45,000 people in our region with no insurance, and over half of them small business. So it gives them some choice finally. But we're at first down, I like to say. At least we have something people can look at, they can analyze, and it'll go over to the Senate now, and they take forever to do things over there. So there's time, and we can try to perfect this. This is not an easy area to legislate in because it affects every single American. And hopefully we will come up with a system that is affordable down the road. The federal government certainly has a responsibility because we know if we don't do anything, by 2020, 2025, almost a third of federal revenues will be going into the health arena, and that is simply unaffordable. So we have to do something for prevention, something for wellness, something to cover those who do not have care today, and we also have to provide more competition in the industry so we get the best bang for the buck.
Does this do enough to create competition and to bring prices down? That's one of the biggest criticisms, is that people were expecting more cost savings and they're seeing a big price tag.
Well, competition will provide cost savings because the antitrust provisions in the bill for the first time break state lines, and plans can compete across states and across the country.
That is a big thing. We've seen states where only one or two insurance companies has the whole pie.
That's right. It absolutely will do that in the House version. And then, for instance, for seniors in the section dealing with prescription drugs, we closed the donut hole for them, and the Department of Health and Human Services on the exchange will negotiate price of pharmaceuticals for essential drugs for seniors who have to get prescriptions, cut them in half, and by 2019 close that donut hole completely. That will affect and impact over 7,500 seniors just in our district, so that's a good thing.
Are you afraid of what the Senate will do to the bill that was passed by the House?
I'm always concerned about the Senate, and let's hope they will be a constructive force. This is something that we have to gain a comfort level with as a society. People shouldn't be anxious. They shouldn't be rude to one another. We should really take a look at what this means. I had a business in my office the other day who said, "Hey, Marcy, I got a payroll of $1.5 million. I have 85 employees. You're telling me this is only going to take 8% of my payroll, and then they would have access to these plans?" I said, "Yes." He said, "Wow." He didn't even really know what was in the bill. It's so much less than he's paying now, and it would give him more choice. His employees could either go on the exchange, pick a plan, or he could buy a plan for all of them. So people have to be comfortable. And the best thing about it is it gives people a blueprint. They can take a look at it, they can choose to like it or not like it, but at least they'll know what is being contemplated. And then you have the whole Senate to go through now if they're going to do something, assuming they could ever reach agreement on something. Then it goes back to a conference committee between both House and Senate. Then it goes back to both chambers again. Then it goes to the President. So we have a long way to go to the goalpost.
Okay. Well, thank you for your time coming in to talk with us. We appreciate it.
Thank you.
Congresswoman Marcy Kaptur, representing the 9th District, and that is tonight's Talk Back.